Welcome back to CTV Morning Live. We have a new Ask the Expert segment for the next few segments from Deschenes and Poitras Dental Center. It's a husband and wife team. If you're looking to get your questions in, 613-789-6559, extension 2803. You can always send us in a question via email, ottawa.morning@ctv.ca, or send us a message via our Facebook page, CTV Ottawa Morning Live. So we're welcoming to our set, welcome our new Ask the Experts. It's Dr. Michael Poitras and Dr. Kathy Deschenes. So great to have you. It looks like, checked out the website, great practice, all-encompassing. Give us a quick rundown as to what it is that you guys do.
Well, we are general practitioner. We're doing, in between both of us, we are doing basically almost everything. I love children, so I do take care most of the time of the children's, and I'll do some endo, like root canal, and Michael's doing the dentures, and basically we cover everything in between both of us, and if we need, we refer to some specialists too.
It must be, and it's a nice working environment. You've got the two of you there.
Yeah.
You like it?
Some people ask me, how do I work with my wife all the time? But I don't. She's in another operatory and I'm at the other end. It works awesome.
And then you get to actually talk to people, because usually with you know, dentists, you're standing over someone, they don't get to talk back to you, right? So at least you have the conversation. We are focusing on children, because the next couple of segments will move through the stages of life, and we got to start right from infancy, and it matters very early on.
Yeah. Baby teeth, a lot of people take them for granted, and they say, well, if you lose a baby tooth, it's not a big deal. If you get cavities and you have to lose that tooth, it's not a problem. It is actually a problem, and it does cause some long damage, because the bone needs to be, the development of the bone is inhibited by losing a tooth early, or the growth, the teeth will crowd. If you lose a baby tooth, and they'll crowd, and then the adult tooth can't come in, it causes a lot of problems. And when misaligned teeth cause jaw joint problems in the long term.
It's a myth to say that why do we fix baby teeth? We should not fixing them, they're gonna fall anyway. Yeah. It's a myth. They have a really important role in the jaw, keeping the position of the adult teeth, and helping actually the kids to eat properly, right?
And so much comes into play, because there's a lot of things that are heading into a baby's mouth and into a child's mouth, from the suses that we put in, from the fingers that they suck on. This all makes a huge difference.
Yeah. And if we start about while feeding your baby, when you have a newborn and etc., there's some nightmare situations that could happen. It's rare. Okay. A lot rarer these days, because education is coming out there.
But we still see it.
But we're still seeing it rarely. But this is baby bottle syndrome. So basically,
it's basically when we leave the bottle of milk with the baby in the cribs, and the baby keep feeding and fall asleep with some milk in his mouth,
or juice
when they get a little bit older, so the sugar stay on their teeth all night.
Yeah, so this is one thing.
You know what? I think I was guilty of that, you know, in some senses, that, you know, you figure, okay, just let them stay with it. Yeah. But it's too much of this, it's soothing for the baby, and then for the parent thinking, okay, they're, you know, we're taking care of them. But this is something that could actually.
It does happen.
It has happened in cases.
It could be a lot worse than this. This is a severe enough case. There's worse cases than this, and there's a lot milder cases. Most of the time, it's milder. And the consequences are dire, because you end up losing some teeth out of this, and this is not aesthetic, and all these teeth are going to shift, because the adult teeth are not ready to come in for several years down the road.
Okay, so interesting. Let's move on to, because there's plenty of slides that we wanted to kind of talk about.
So how much toothpaste should you put on? A lot of people...
Classic question that we have lots of time. Do we put toothpaste on the toothbrush, on a baby toothbrush? How we manage that?
Under 2, nothing. Around 2 to 6, a little bit, you barely see it. At around 6, you start putting more, if they're good at spitting or not. Kids shouldn't brush their teeth alone until they're 9 or 10. They don't have the dexterity, don't know where to go.
Until they're 9 or 10?
Yeah. Well, what do? They go and they brush there.
Right.
They brush there. They brush there. And they didn't do the tongue side, they didn't do that, they didn't do the front, they didn't do this, and we see it all the time.
Is this about maybe a parent taking more responsibility, that they stand over their child? You know,
Well,
sometimes we say, go brush your teeth and I'll meet you and we'll wait for bed, but that you stand over them and you watch exactly what it is that they're doing.
I usually say, let the child do it first, and then say, like, mommy or daddy will check and do it again. So, and then because they don't have the dexterity, they don't have the everything they need to brush.
And a lot of people say, well, my child gives me a hard time with brushing the teeth. Get them used to when they're newborns, but babies have a washcloth and they play with it in their mouth. Play in their mouth right from the beginning, and they'll be used to you being in there.
Yeah.
Give a toothbrush while they're in the bathtub. Why not? They're going to play with it, chew on it and everything. They're going to be used to having that in their mouth. And then when they get their teeth and later on, it's going to be easy. It's going to be a no-brainer. And they know bath time, they have that little thing to play with in their mouth. It's done.
2 and under, no toothpaste.
Yeah.
2 to...
2 to 6, 5, 6. Then you get into pea size. This is like just a smidgen,
a little
barely nothing.
The key is they have to spit. So soon as they know how to spit properly, because most of the time when they put the toothbrush in their mouth, they suck on it and they swallow it. So this is the bad things.
We have so much more information to get to. There's a ton of other slides that I want to get to, but we have to take a commercial break. This is how you can get a hold of us. You can send the questions in live, 789-6559, extension 2803. The information is there as well as to sending us in an email or a message via Facebook. We're going to take a commercial break. We'll be back with more right after this.